Meanwhile, Indiana lawmakers say one of their top priorities this session is lowering health care costs. Fox 59 State House reporter Kristen Eskow shows us a bill that would punish hospitals if they charge too much.
Lawmakers say they've been working on this proposal for about 2 years now. During testimony in committee, many supporters say they believe this will help lower health care costs, but hospitals offered some pushback. Indiana lawmakers say Hoosiers are facing significantly higher health care costs compared to the national average. State Representative Donna Shibley is leading an effort to try to bring down those prices.
The average hospital facility fee in Indiana is 329% of the federal Medicare rates, while the national average is 260% of the federal Medicare rates.
Shibley's bill aims to increase competition among providers. Her bill would ban certain nonprofit hospitals from forcing doctors to sign non-compete employment agreements. And it would provide a $10,000 tax credit to doctors who have an ownership stake in their practice instead of working for a hospital system. Matt Bell helps run Hoosiers for Affordable Health Care.
Supporting independent physicians is not only an important element of accessibility, it is a way to lower costs in Indiana.
The bill would also set a cap on some health care expenses. If a nonprofit hospital charges more than the national average, the hospital would face financial penalties. Economics professor Mike Hicks predicts the proposal would save Hoosiers money.
I think after about 4 years, we should expect this legislation to potentially reduce prices by about 15%.
But Brian Mills of Community Health Network argues hospital fees aren't entirely in their control.
Pharmaceuticals, devices, various therapies that we do, we don't set those prices.
Mike Schroyer, who runs a hospital in New Albany, argued many hospitals can't afford these changes.
A hospital that is running on negative margins does not have excess $30 million.
Lawmakers did not take a vote on the bill in committee, but they do plan to vote on the bill next week. Now, in the meantime, there are several other bills being considered focused on health care costs. One bill aims to lower prescription drug costs, and another focuses on insurance companies and reimbursements. At the State House, Kristen Eskow, Fox 59 News.
Kristen, thank you.